The emergency room at Naval Medical Center was having one of those nights where chaos felt normal. Doctors rushed between patients, nurses called out vital signs, and the steady beep of monitors created a symphony of urgency that everyone had learned to work through. It was nearly midnight when the ambulance bay doors flew open. Two medics rushed in with a stretcher carrying a man who looked like he'd been through hell. His uniform was torn and bloodied, and even through the oxygen mask, you could see the tight grimace of someone fighting serious pain. Lieutenant Commander Ryan Hayes was his name, though most people just knew him by his reputation. He was a Navy SEAL who'd been injured during a training exercise that had gone very wrong. The details were classified, but the injuries were all too real. Dr. Richard Thornton was the senior trauma surgeon on duty that night. He was in his late 50s with silver hair and the kind of confidence that came from 30 years of putting people back together. Some called it confidence. Others had different words for it. He'd built a reputation as one of the best trauma surgeons on the West Coast, and he knew it. Everyone knew it because he reminded them regularly. "What do we have?" Dr. Thornton barked as he snapped on his gloves. The paramedic rattled off the details. Multiple injuries from a fall during a training op. Possible internal trauma, fractured ribs, severe contusions across the torso and legs. Blood pressure has been dropping steadily during transport. Working quietly but efficiently on the other side of the bed was Jennifer Cole, a trauma nurse who'd been at the hospital for 5 years. She had dark hair pulled back in a practical ponytail, and the kind of steady hands that came from having seen just about everything an emergency room could throw at you. While the doctor barked orders and residents scrambled to follow them, Jennifer was already cutting away the patient's uniform, starting an additional IV line, and calling out vitals. "Pulse is 120 and thready. BP is 90/60 and dropping," she said, her voice calm but firm. "Respirations are shallow. He's showing signs of shock." Dr. Thornton barely glanced at her as he began his examination. "Yes, I can see that. Type and cross for 6 units. Get me a chest X-ray and someone page orthopedics." Jennifer nodded but continued her own assessment. Her hands moved across the patient's abdomen, feeling for rigidity and distension. Something wasn't right. Years of experience had taught her to trust that feeling in her gut when things didn't add up. "Doctor, I'm concerned about his abdomen. It's rigid and distending. His left flank is showing discoloration. I think we need to consider internal bleeding beyond what we're seeing," she said, looking up at Dr. Thornton. The doctor paused for just a second, then continued his examination. "The mechanism of injury suggests orthopedic trauma primarily. We'll do the standard trauma protocol. Let's not jump to conclusions. Sir, with respect, his blood pressure keeps dropping despite fluids. And look at his abdomen. It wasn't this distended when he came in 5 minutes ago." "It's happening fast," Jennifer pressed. 3 young residents stood nearby, watching the exchange with wide eyes. They'd all heard stories about Dr. Thornton's temper, and they could feel the temperature in the room dropping. Dr. Thornton straightened up and turned to face Jennifer with a look that could freeze water. "Nurse Cole, I appreciate your observations, but I've been doing this since before you were in elementary school. I'll decide what scans we need and when we need them. You focus on following orders." The room went quiet except for the persistent beeping of monitors. Even Lieutenant Commander Hayes, barely conscious, seemed to sense the tension. Jennifer's jaw tightened, but she kept her voice level. "I understand, Doctor. I'm just advocating for the patient based on what I'm seeing clinically." "What you're seeing," Dr. Thornton said, his voice dripping with condescension as he turned to address the residents instead of Jennifer, "is a nurse trying to play doctor. This is exactly why we have medical school and residency training. Not everyone is qualified to make diagnostic decisions." One of the residents, a young woman fresh out of medical school, looked uncomfortable. She'd been watching Jennifer work and had noticed the same things. But she wasn't about to contradict the attending physician on her second week of trauma rotation. Dr. Thornton continued his lecture, using Jennifer's concerns as a teaching moment. "You see, what we have here is a classic case of someone—" He paused, glancing dismissively at Jennifer, "who doesn't understand the full clinical picture. She's just a nurse. She sees symptoms but doesn't have the training to interpret them in context. This is why hierarchy exists in medicine." The words hung in the air like smoke. "She's just a nurse." Jennifer's face remained professionally neutral, but something flickered in her eyes. The other nurses in the trauma bay exchanged glances. They'd all heard variations of this before, but it never stopped stinging. Now, Dr. Thornton continued. We'll follow standard trauma protocol. Chest x-ray first, then we'll assess from there. Someone get me those films as soon as they're ready. Jennifer said nothing more. She went back to her work, adjusting IV drips, monitoring the patient's declining vitals and documenting everything she observed. But she didn't stop watching. She couldn't. Something was very wrong, and she knew it in her bones. Lieutenant Commander Hayes drifted in and out of consciousness. The pain medication was keeping the worst at bay, but every breath felt like knives in his chest. Through the fog of pain and drugs, he was aware of voices around him, of hands working on his body, of the bright lights overhead. Jennifer leaned close to check his pupils and adjust his oxygen mask. You're going to be okay, she said quietly. We're taking care of you. Through his haze, Hayes noticed something. The way she moved. The way her hands checked his wounds with a specific kind of efficiency that wasn't just nursing training. There was something familiar about it, something that triggered recognition deep in his memory. His eyes, struggling to focus, caught sight of her forearm as she reached across to adjust the IV. There, partially visible beneath the edge of her scrubs, was a tattoo. It was faded and partially hidden, but he recognized it. The design was distinctive, something you didn't see outside certain military circles. He tried to speak, but the oxygen mask and the pain made it difficult. He managed to rasp. Jennifer looked down at him. Don't try to talk, Commander. Save your energy. I know you, he whispered, his eyes trying to focus on her face. She gave him a professional smile. You're probably confused from the medication. That's normal. Just rest. But Hayes shook his head slightly, wincing at the pain the movement caused. His training as a SEAL had taught him to notice details, to recognize people and patterns even in the worst circumstances. And something about this nurse, the way she carried herself, the military precision in her movements, that tattoo was setting off recognition alarms in his brain. The chest x-ray came back, and Dr. Thornton studied it with the residents gathered around. As you can see, we have 3 fractured ribs here and here, but no pneumothorax. Lungs look clear. We'll focus on pain management and orthopedic consultation. Jennifer looked at the x-ray from across the room, then back at her patient. His blood pressure had dropped another 5 points. His abdomen was visibly more distended than 15 minutes ago. The discoloration on his flank was spreading. She made her decision. Walking directly to Dr. Thornton, she kept her voice low but firm. Dr. Thornton, I need you to listen to me. This patient is bleeding internally. His abdomen has increased in girth by at least 3 centimeters since arrival. His blood pressure continues to drop despite aggressive fluid resuscitation. That flank discoloration is classic Gray Turner's sign. We need a CT scan of his abdomen now, and we need to prepare for possible surgical intervention. Dr. Thornton's face flushed red. The residents took an instinctive step back. Dr. Thornton's face went from annoyed to furious in a heartbeat. He stepped closer to Jennifer, his voice low but sharp enough that everyone in the trauma bay could hear every word. Nurse Cole, you are way out of line. I don't know what's gotten into you tonight, but you need to step back and remember your place in this hospital. I am the attending physician. I make the diagnostic calls. You take orders. That's how this works. Do I need to have you removed from this case? Jennifer stood her ground, though her hands trembled slightly at her sides. Sir, I'm not trying to undermine you. I'm trying to save this patient's life. Something is very wrong, and every minute we wait— Enough. Dr. Thornton cut her off. I've examined this patient thoroughly. I've reviewed the imaging. There is no indication for a CT scan at this time. What you're describing is speculation based on incomplete understanding of trauma pathology. Now either you can follow my orders, or you can leave this trauma bay. Your choice. The room was so quiet you could hear the fluorescent lights humming overhead. The other nurses didn't know where to look. The residents shifted uncomfortably, their eyes darting between the angry surgeon and the nurse who wouldn't back down. Jennifer opened her mouth to argue again, but before she could speak, a weak voice cut through the tension. Listen to her. Lieutenant Commander Hayes rasped from the bed. Everyone turned to look at the patient. His eyes were barely open, and speaking clearly took enormous effort, but he was trying to say something. Dr. Thornton's expression softened slightly as he approached the bed. Commander Hayes, you need to rest. The pain medication can cause confusion. We're taking excellent care of you. Hayes shook his head with great effort. His hand moved weakly, trying to gesture toward Jennifer. Not confused, listen to her. You don't? You don't know. Commander, I appreciate your input, but you're in no condition to assess your own medical care right now, Dr. Thornton said in that patronizing tone doctors sometimes use with patients they think aren't thinking clearly. But Hayes wasn't giving up. He grabbed the doctor's sleeve with surprising strength for someone in his condition. His eyes locked onto Dr. Thornton's, and despite the pain medication, there was clarity there. Sharp, focused clarity. You have no idea who she is, Hayes whispered, each word an effort. Listen to her. That's an order. Dr. Thornton blinked, taken aback. Commander? With all due respect, this is a medical facility, not a military operation. You don't give orders here. Doctor, Hayes insisted, his breathing labored. I know her. From before, trust me. Listen to what she's saying, please. Dr. Thornton pulled his arm free gently and glanced at Jennifer with confusion mixed with irritation. You know this patient? Jennifer's face was carefully neutral. I've never met Commander Hayes before tonight. See? He's clearly disoriented from the medication and trauma, Dr. Thornton said, turning back to his residents. This is actually a perfect teaching moment about altered mental status in trauma patients. Pain medication, stress, shock, they can all cause confusion and even hallucinations. But Hayes wasn't letting it go. Despite the pain, despite the medication making everything foggy, something in his SEAL training was screaming at him to pay attention. He'd seen that tattoo before in briefings. He'd heard stories, and the way she moved, the way she assessed injuries, the confidence in her clinical observations. This wasn't just a nurse with good instincts. Afghanistan, Hayes managed to say, his eyes on Jennifer. You were there. I've seen your work in reports. Jennifer's expression flickered for just a second. Something crossed her face, pain maybe, or old memories she'd rather not revisit. But she quickly pushed it away. Commander Hayes, you need to rest, she said softly, but her voice carried a different tone now. Less like a nurse talking to a patient and more like one soldier acknowledging another. One of the residents, the young woman who'd been uncomfortable earlier, stepped forward hesitantly. Dr. Thornton, maybe we should consider the CT scan. Just to be safe? The patient seems really insistent, and Nurse Cole has been here a long time. She knows trauma. Dr. Thornton turned on her with barely contained anger. Dr. Peterson, are you seriously suggesting we order expensive imaging based on the confused rambling of a medicated patient and the gut feeling of a nurse? This is medicine, not guesswork. We follow protocols. We use evidence-based practice. We don't waste hospital resources because someone has a hunch. Dr. Peterson's face flushed and she stepped back, properly chastised. The other residents looked at their shoes, but something was shifting in the room. Hayes's words had planted a seed of doubt, even if Dr. Thornton refused to acknowledge it. The nurses were watching Jennifer with new curiosity. A respiratory therapist who'd just arrived to check the patient's oxygen levels paused, looking between Jennifer and the SEAL with interest. Jennifer checked Hayes's blood pressure again. 85/55, dropping further. His heart rate was climbing, 130 beats per minute. His skin was becoming pale and clammy, all signs of worsening shock. She looked at the cardiac monitor, then back at her patient's distended abdomen. The discoloration on his flank was definitely spreading. This wasn't her imagination. This was textbook internal bleeding, and it was getting worse. Making a decision, Jennifer pulled out her phone. Dr. Thornton saw her and snapped, "What are you doing?" "I'm documenting my clinical observations," Jennifer said calmly. "If this patient deteriorates, there needs to be a record that concerns were raised and when." It was a bold move, and everyone in the room knew it. She was essentially creating evidence that could be used against the doctor if things went wrong. Dr. Thornton's face went purple. "You are walking a very thin line, Nurse Cole. Very thin. I could have you written up for insubordination. I could have you removed from trauma rotation entirely." "You could," Jennifer agreed, her voice steady. "But first you'd have to explain why you ignored clear signs of internal hemorrhage. Why you dismissed clinical observations from an experienced trauma nurse. Why you refused to order a simple CT scan that could have saved a patient's life." The air in the trauma bay crackled with tension. This was more than just a disagreement about patient care now. This was a battle of wills, of egos, of hierarchy versus experience. Lieutenant Commander Hayes, watching this unfold through his pain-fogged consciousness, tried again. "Doctor, please, I've seen combat medicine. I know what good looks like." She knows. She's seen things. Done things. In places where mistakes meant body bags, just listen. His voice was getting weaker, but his words were hitting home. The residents exchanged glances. Even Dr. Thornton seemed to hesitate for a moment. What exactly are you suggesting, Commander? Dr. Thornton asked, his voice still skeptical but slightly less hostile. That this nurse has some kind of special knowledge that makes her more qualified than a trauma surgeon with 3 decades of experience. Hayes managed something that might have been a laugh if it didn't hurt so much. Not suggesting. Telling you. That tattoo on her arm. I've seen it before. On special operations medical personnel. People who've done things and saved lives in conditions you can't imagine. Jennifer's hand instinctively moved to cover her forearm, pulling her sleeve down. But it was too late. Several people had already noticed, were already looking more closely. One of the older nurses, a woman named Patricia who'd worked at the hospital for 20 years, stepped closer. She'd always known there was something different about Jennifer. Something in the way she handled the worst traumas with a calmness that seemed almost unnatural. Jennifer, Patricia said quietly, is what he's saying true? Jennifer didn't answer. She just kept her eyes on her patient, on the monitors, on the slowly deteriorating vital signs that were confirming everything she'd been trying to tell them. Dr. Thornton waved his hand dismissively. This is ridiculous. Even if Nurse Cole has military experience, which proves nothing about her current medical judgment, it doesn't change the clinical picture. This patient has orthopedic injuries, possible rib fractures, and he's being appropriately managed. Then explain the dropping blood pressure, Jennifer said, her voice quiet but firm. Explain the progressive abdominal distension. Explain the Gray Turner's sign that's spreading across his flank. Explain why his heart rate keeps climbing despite pain control. These aren't orthopedic symptoms, doctor. This is hemorrhagic shock. Before Dr. Thornton could respond, an alarm sounded. Hayes's blood pressure had dropped to 75/45. His oxygen saturation was falling. His eyes rolled back slightly and his body went rigid. He's crashing, one of the residents yelled. Suddenly, the trauma bay exploded into controlled chaos. The moment Hayes's monitors started screaming, everything changed. The academic debate about hierarchy and experience became irrelevant. Now it was just about keeping a man alive. Start another line. Push fluids wide open, Dr. Thornton shouted, his earlier arrogance replaced by urgent focus. Someone get me blood products now. Jennifer was already moving before he finished speaking. Her hands flew across the crash cart, pulling out supplies with practiced precision. I need O-negative blood. 4 units to start. And get the rapid infuser ready. The residents scrambled to help, but Jennifer was 3 steps ahead of everyone. She'd seen this before, in situations far more desperate than a well-equipped American hospital. She knew exactly what was coming next. Hayes's body was shutting down. His blood pressure continued to plummet, 70/40, 65/38. The numbers told a story that couldn't be ignored anymore. His abdomen is rock hard now, Dr. Peterson said, her hand on Hayes's belly. She looked at Dr. Thornton with fear in her eyes. Dr. Thornton, I think Nurse Cole was right. I think he's bleeding out internally. Dr. Thornton's jaw clenched. He moved to examine the patient himself, his hands pressing carefully on the distended abdomen. The reality of the situation was undeniable now. Hayes wasn't just injured, he was dying. Get me a portable ultrasound, now, Dr. Thornton ordered, his voice tight. Jennifer was already wheeling it over. She'd positioned it nearby 20 minutes ago, anticipating this exact moment. She powered it on and handed Dr. Thornton the probe. He placed it on Hayes's abdomen and the screen showed what Jennifer had been trying to tell him all along. Free fluid, lots of it, blood pooling in the abdominal cavity, dark and unmistakable on the ultrasound image. He's got massive hemoperitoneum, Dr. Thornton said, his face going pale. He's bleeding into his abdomen. We need to get him to surgery right now. I told you that 30 minutes ago, Jennifer said quietly, but there was no triumph in her voice, only urgency. We've lost 30 minutes. He's in severe shock now. We need to move fast. Dr. Thornton looked at her, really looked at her for the first time that night. Something shifted in his expression. Call the OR. Tell them we're coming up with a ruptured spleen, possible liver laceration. This is a damage control situation now. The trauma bay transformed into coordinated chaos. Nurses called the operating room. Residents prepped the patient for transport. Anesthesia was paged. Everyone moved with purpose, but the weight of those lost 30 minutes hung heavy in the air. Jennifer worked alongside everyone else, but her mind was racing ahead, anticipating complications, preparing for what came next. This was the part she'd walked away from years ago. The surgical decisions, the weight of a life literally in your hands, but old instincts were flooding back whether she wanted them to or not. As they prepared to move Hayes to the elevator, Dr. Thornton turned to Jennifer. "You're scrubbing in with me. It wasn't a request. It was an order. But it was also an acknowledgement." Jennifer hesitated. "Doctor, I'm not on the surgical roster. I work trauma bay rotations. I don't care what your current assignment is. You saw what I missed. Your clinical judgment may have just saved this man's life, even though I was too stubborn to listen. I need you in that OR." He paused, then added more quietly, "Please." The word "please" from Dr. Richard Thornton was rare enough that several nurses glanced at each other in surprise. Jennifer nodded slowly. "All right, let's go." They rushed Hayes to the elevator and up to the surgical floor. The operating room team was already prepping when they burst through the doors. Hayes was barely conscious now, his body fighting a losing battle against shock and blood loss. As Jennifer scrubbed in alongside Dr. Thornton and the surgical team, her hands moved through the familiar motions. Scrub the fingers, then the hands, then the forearms. The rhythmic washing had once been as natural as breathing. Now it brought back memories she'd buried deep. Through the window into the OR, she could see Hayes being prepped. The anesthesiologist was working quickly, placing lines and preparing to put him under. Every second counted. Dr. Thornton scrubbed next to her, his face grim. "How did you know?" he asked quietly. "I've been doing trauma for 30 years. I should have caught this." Jennifer kept her eyes on her hands, watching the antiseptic soap run down her arms. Sometimes the most obvious injuries hide the deadly ones. In combat situations, you learn to trust your instincts because you don't always have time for every test. You read the body's signals, the skin color, the breathing pattern, the way shock progresses. Books teach you medicine, but experience teaches you to see what's really happening. "Combat situations," Dr. Thornton repeated. "Commander Hayes recognized you. He said you were in Afghanistan." Jennifer didn't respond immediately. She finished scrubbing and backed through the OR doors, arms up, water dripping. A surgical nurse helped her into a sterile gown and gloves. "That was a long time ago," Jennifer finally said. "Another life." The surgical team moved into position around Hayes. Dr. Thornton stood at the head of the table as the lead surgeon. Jennifer positioned herself across from him. The moment felt surreal. She hadn't stood in this position in 5 years. "Scalpel," Dr. Thornton said, his hand extended. The surgery began. The moment Dr. Thornton made the first incision and entered the abdominal cavity, blood welled up from the opening. Dark venous blood, lots of it. "Suction," Dr. Thornton called out. "I need visualization. There's easily 2 liters of blood in here." The surgical team worked to clear the blood, but it kept coming. They needed to find the source and stop it fast. Jennifer's eyes scanned the surgical field with practiced efficiency. "Spleen's shattered," she observed. "But there's more bleeding than that accounts for. Check the mesentery and the retroperitoneum." Dr. Thornton followed her gaze. She was right. The spleen was badly damaged. But there was also a tear in the mesentery, the tissue that holds the intestines in place, and blood was pumping from vessels that had been ripped apart. "I need to clamp that bleeder," Dr. Thornton said, his hands moving quickly. But the blood was making it hard to see clearly. The tissue was torn and fragile. Every movement had to be precise. Jennifer didn't wait to be asked. Her hands moved into the surgical field, anticipating what Dr. Thornton needed before he asked for it. She held tissue out of the way, provided counter-tension, suctioned at exactly the right moment. They moved together like a practiced team, even though they'd never worked a surgery together before. "Clamp," Dr. Thornton said. Jennifer had it in his hand before he finished the word. He clamped the bleeding vessel and the flow of blood slowed significantly. The surgical field became clearer. Now they could really assess the damage. "We need to take the spleen," Dr. Thornton said. "It's beyond repair. Dr. Peterson, come in here and help mobilize it." The young resident stepped forward, but her hands were shaking. She'd never done a splenectomy before, and certainly not one under these emergency conditions. Jennifer watched the resident struggle for a moment, then quietly moved to guide her. Here, hold this tissue like this. See how it gives you better exposure? Now when Dr. Thornton cuts, maintain that tension. Steady hands. You've got this? Dr. Peterson looked at Jennifer with gratitude and focused on following her instructions. With Jennifer's guidance, the removal of the damaged spleen went smoothly. But as they worked, Jennifer noticed something else. Doctor, look at the liver. Upper right lobe. There's a laceration there too. Dr. Thornton shifted his attention and saw what Jennifer was pointing out. A tear in the liver oozing blood steadily. Not the massive bleeding they'd just controlled, but enough to be dangerous if left alone. You've got good eyes, Dr. Thornton muttered. All right, let's address that before we close. We'll use some hemostatic gel and possibly a few sutures if the tissue will hold. As they worked on the liver laceration, Dr. Thornton kept glancing at Jennifer. The way she moved, the way she anticipated surgical steps, the confidence in her hands. This wasn't normal nursing experience. This was surgical training, advanced surgical training. You were a surgeon, Dr. Thornton said. It wasn't a question. Jennifer's hands never stopped moving, but her voice was quiet. Yes, Army combat surgeon? Forward operating bases in Afghanistan. 3 tours. The OR went silent except for the beeping of monitors and the hiss of the ventilator. Everyone was staring at Jennifer now, seeing her in a completely different light. Why are you working as a nurse? Dr. Peterson asked, her voice full of confusion. If you were a surgeon, why would you step down? Jennifer was quiet for a long moment. Her hands kept working, kept helping, but something painful flickered across her face. Because being a surgeon in combat means making impossible choices, she finally said. It means losing patients despite your best efforts. It means operating on 20-year-old kids who should be in college, not bleeding out on a table in a tent in the desert. It means carrying the weight of every life you couldn't save. The operating room remained silent as Jennifer's words hung in the air. Her hands continued their precise work, holding tissue, providing traction, moving with the kind of muscle memory that never really goes away no matter how many years pass. Dr. Thornton cleared his throat and continued working on the liver laceration. How many surgeries did you perform over there? I stopped counting after 500, Jennifer said softly. In a combat zone, you don't get the luxury of specialization. Chest injuries, abdominal trauma, vascular repairs, orthopedic emergencies. You do whatever needs doing to keep someone alive long enough to get them to better care. Dr. Peterson's eyes were wide above her surgical mask. 500 surgeries in combat conditions? I can't even imagine. You don't want to imagine it, Jennifer replied. Her voice carried the weight of memories she'd rather forget. You operate in tents when it's 120 degrees outside. You work by flashlight when the generators fail. You make decisions in 60 seconds that would take a full surgical team hours to debate back here. And sometimes, no matter what you do, it's not enough. The surgical team worked in focused silence for several minutes. Dr. Thornton applied hemostatic gel to the liver laceration, and the bleeding finally stopped. Hayes's vital signs were beginning to stabilize. The blood transfusions were working. His pressure was coming back up slowly, 80/50, then 85/55. He's going to make it, the anesthesiologist announced. Vitals are improving. He's responding well to the transfusions. A collective sigh of relief rippled through the OR. They'd pulled him back from the edge. Dr. Thornton began the careful process of closing, checking one last time for any bleeding they might have missed. Nurse Cole? He paused, then corrected himself. Dr. Cole, you saved this man's life tonight. If we'd waited even another 10 minutes before getting him to surgery, we would have lost him. Jennifer didn't respond immediately. She was staring at Hayes's face, peaceful now under anesthesia, his body finally getting the help it desperately needed. How many faces like his had she seen? How many young soldiers had she fought to save on operating tables in the desert? I'm not a doctor anymore, she finally said. I'm a nurse. That was my choice, but why? Dr. Peterson asked, unable to contain her curiosity. You clearly have incredible skills. You could be saving lives as a surgeon here? Jennifer helped Dr. Thornton with the final layers of closure, her movements automatic. When she spoke, her voice was barely above a whisper. There was a night about 5 years ago. We got hit with mass casualties, an IED attack on a convoy. 12 injured soldiers came in within 20 minutes. We only had 2 surgeons and limited supplies. I had to choose who to operate on first, who could wait, who was too far gone to save. She paused, her hands stilling for just a moment. There was a kid barely 19 years old. His name was Tyler Chen. He kept asking me if he was going to make it, if he'd see his mom again. I told him yes, even though I knew he probably wouldn't. I had to focus on the ones I could save. He died waiting for surgery while I worked on someone else. The OR was completely silent now except for the quiet beeping of Hayes' steady heartbeat on the monitor. I made the right medical decision that night, Jennifer continued, her voice thick with emotion. I saved 3 lives by making that choice. But Tyler's face, the way he looked at me with trust in his eyes, I see it every time I close my eyes. I see all their faces. The ones I couldn't save. Dr. Thornton finished the last suture and stepped back. That's the burden every combat surgeon carries. You made impossible choices in impossible situations. You saved more lives than most surgeons will save in their entire careers. I know that intellectually, Jennifer said. But knowing something and living with it are different things. After my 3rd tour, after losing my husband in combat too, I just couldn't carry that weight anymore. Being a trauma nurse lets me help people, save lives without making those kinds of choices. I follow someone else's orders. I don't decide who lives and who dies. She looked at Dr. Thornton directly. That's why I pushed so hard tonight. That's why I wouldn't back down even when you told me to. Because I've seen what happens when you miss the signs, when you wait too long. I couldn't let another soldier die because someone was too proud to listen. Dr. Thornton pulled off his surgical gloves slowly, his face showing genuine emotion for the first time all night. And I almost let my ego kill a patient. You were right about everything, and I dismissed you because you were just a nurse. He shook his head with disgust at his own words. Those may be the stupidest words I've ever said in my career. The surgical team began cleaning up as Hayes was prepared to be moved to the ICU for recovery. His vital signs were stable now. The crisis had passed. As they left the OR and moved to the scrub room to wash up, Dr. Thornton turned to Jennifer. I owe you an apology. A real one. Not just the half-hearted admission in there. What I said to you in the trauma bay was disrespectful, dismissive, and dangerous. I let my pride cloud my judgment, and it almost cost a man his life. Jennifer scrubbed the surgical soap from her hands, watching the water run clear. I appreciate that, Dr. Thornton, but I'm not the one who needs the apology most. It's every nurse, every technician, every person in that hospital who has good clinical judgment but gets dismissed because they don't have MD after their name. Dr. Thornton nodded slowly. You're right. This isn't just about tonight. This is about a culture problem I've been contributing to for years. He paused, then asked, would you consider coming back to surgery? With your experience and skills, you could do incredible work here. Jennifer dried her hands and shook her head. No, I appreciate the offer, but I meant what I said. I'm at peace with being a nurse. I help people. I save lives when I can. But I don't carry the weight of surgical decisions anymore. That's where I need to be right now. I understand, Dr. Thornton said. But the hospital and I are lucky to have you in whatever capacity you choose to work. They walked together to the ICU where Hayes was being settled into a bed. He was still unconscious from the anesthesia, but his color was better. The monitors showed strong, steady vital signs. He was going to survive. Jennifer stood by his bedside for a moment, adjusting his IV and checking his dressings with practiced care. Dr. Thornton watched her work with new respect. You know, Dr. Thornton said quietly, Commander Hayes kept saying we had no idea who you were. He was absolutely right. Jennifer gave a sad smile. I'm just someone who's trying to do good work and leave the past where it belongs. Over the next few days, word spread through the hospital about what had happened in the trauma bay. The story grew in the telling, but the core truth remained. A nurse had saved a patient's life because she refused to be silenced, and a surgeon had learned that hierarchy meant nothing compared to clinical truth. Dr. Thornton called a meeting with the entire trauma department. Nurses, doctors, residents, technicians, everyone who worked in emergency medicine gathered in the conference room. I need to talk to you all about something that happened the other night, Dr. Thornton began. He told them the whole story, holding nothing back. He admitted his mistakes, his arrogance, and how close it had come to costing a patient his life. From this day forward, this department operates differently, he continued. Every voice matters. Nurse, resident, tech, I don't care what title you have. If you see something that concerns you, you speak up. If you make a clinical observation that doesn't fit the picture, you advocate for your patient. And anyone who dismisses those concerns will answer to me. He looked directly at Jennifer, who sat in the back of the room. We have people working in this hospital with extraordinary experience and skills. It's on us as physicians to listen, to respect that experience, and to put our egos aside for the good of our patients. The room erupted in applause. Jennifer felt her face flush, uncomfortable with the attention but grateful for the change Dr. Thornton was trying to make. A week later, Commander Ryan Hayes woke up in his hospital room to find Jennifer checking his vitals during her shift. "You," he said, his voice hoarse but clear. "I remember you now. The briefings, they called you the Angel of Kandahar. You saved over 40 special operations personnel during your tours." Jennifer's hand froze on his IV line. She hadn't heard that name in years. "That was a long time ago, Commander. Different person, different life." Hayes shook his head carefully, still sore from surgery. "You don't stop being who you are just because you change your job title. You saved my life. Not just in surgery, I know what happened. They told me you fought for me when that doctor wasn't listening." "I was just doing my job," Jennifer said softly. "No," Hayes insisted. "You were being exactly who you've always been. Someone who fights for the people who can't fight for themselves. Someone who refuses to let ego or hierarchy get in the way of doing what's right." He paused, then added, "The SEALs have a saying, the only easy day was yesterday. You lived that every day in Afghanistan. You're still living it here." Jennifer felt tears threatening but pushed them back. "Thank you, Commander." "That means a lot, Ryan," he corrected. "Call me Ryan, and thank you. For saving my life twice, once when you refused to shut up, and once when you helped put me back together." 3 months later, the hospital held a ceremony recognizing exceptional clinical performance. Dr. Thornton personally nominated Jennifer for the hospital's highest nursing honor. When she walked to the stage to accept the award, the entire trauma department stood and applauded. But more importantly than any award, the culture in the trauma department had genuinely changed. Doctors actively sought input from nurses. Residents were taught from day one that good medicine meant listening to everyone on the team. And Dr. Thornton became known not just as a skilled surgeon, but as a leader who had the courage to admit when he was wrong and change how he practiced medicine. Jennifer continued working as a trauma nurse, finding fulfillment in each shift, each patient she helped. She still carried the weight of her past, the memories of soldiers she couldn't save. But now she also carried something else. The knowledge that speaking truth to power, refusing to be silenced, and fighting for patients could change not just individual lives but entire systems. Late one night, as she finished her shift and walked through the quiet hospital corridors, she passed the trauma bay where it had all happened. She could still hear Dr. Thornton's dismissive voice. "She's just a nurse." Jennifer smiled to herself. Just a nurse, as if there was anything just about the work nurses did every single day. As if experience and dedication and clinical judgment could be diminished by a job title. She thought about Tyler Chen and all the others she'd lost. She thought about Commander Hayes and all the patients she'd helped save. And she realized that maybe, just maybe, she was finally finding peace with both parts of her story. The surgeon she'd been and the nurse she'd become. Because in the end, the title didn't matter. What mattered was showing up every day, fighting for patients, refusing to be silent when something was wrong, and using whatever skills and experience you had to make a difference. That was who she'd always been. That was who she'd always be, and there was nothing just about that.